Oh, I'm live. Okay. Hello, everybody. My name's David Collins. I'm the founder of the Foundation Clinic, and I'm sitting here in my loft at home, and I've gone live as I'm trying to test technology and to see how we can get the message of recovery out there to families that are impacted by addiction and substance abuse. So we're very passionate about technology and getting the message of recovery out there into the world. So I've been testing here. We've been using Facebook and social media to post live videos, and now I'm on YouTube. And so this is my first live video as the founder of the organization, which I'm kind of going ad lib out there to wax lyrical out there to the world to see, see if anyone responds. We have 198 subscribers on our YouTube channel, and on our Facebook page we've got something like 4,000 followers. And really what I want to do is just see how we can broadcast through both streams, so we can get out to the Facebook world and we can get out to the YouTube world. And because really what we do is the clinic is held in a trust. It's a public benefit organization, and the trust is called the Ubuntu Addiction Community Trust. And the word Ubuntu means, if I was to translate it, we all suffer together, or we all rise together, and it's very inclusive. So we want to use that spirit of Ubuntu to help everyone, to bring everyone up from a culture of addiction to a culture of recovery. And I'll always talk about a culture of learning, where people learn about culture of addiction and how to move to a culture of recovery. And a culture of recovery is an environment that is filled with recovery capital, which basically means there's internal resources and external resources available to you when you want to change your behavior. An addiction being a systemic illness, it doesn't only impact the person that's got the problem, it impacts family members and society and the workplace as a whole. And it's a stigma-based illness. People don't see it as an illness. I think it's a moral dilemma. They'll, why can't you just pull yourself together? Why do you behave like that? Let's throw you in jail. Maybe you'll stop your behavior. And this becomes very frustrating from a treatment perspective. So how can we treat people with this condition? And as I'm looking here, nobody's coming on, and that's fine. But hopefully it will capture this video, and it'll be part of our video series. Excuse me. And my hope is, as technology changes and as the environment changes, we'll be able to get the message of recovery out there to more and more people. We used to be called SHARP, which used to stand for the Self-Help Addiction Recovery Program, and we've now changed it to the Foundation Clinic. And the Foundation Clinic is, the word foundation is when people come into our clinic, they learn about the foundational stuff of recovery, and hopefully they'll go out and they'll be built up on top of that, because the word clinic means place of bedside learning. It comes from French. And so our idea is that people come into our clinic and it's more like a school. So people will come in and they'll be assisted with a medical detox, and then they'll enter a program. And the detox lasts anywhere between 3 and 10 days, depending on the substance. And then people enter the clinical program, where they'll learn about addiction and how to move into recovery. And we tailor-make programs for individuals based in a framework of living the solution, which is kind of around complete abstinence. So people don't come in to kind of learn how to use a substance successfully. They're much rather about why that substance is being used, what are the symptoms that's of the person's environment that make them abuse substances. And there are 4 causes to addiction, and we educate our clients around them, and then we have a holistic approach to it. So it's a mixture of 12-step stuff, CBT stuff, cognitive behavioral therapy. We use a lot of coaching, recovery coaching, And yeah, we not only treat the individual, but we also treat the family members as well, or assist the family members. And it's really helpful for us if the family members get involved in people's treatment, and because we have to send our clients back to their family environment. So if the family can learn some tools on what to do and how to change their behavior and their response, it makes it easier for everyone. And after people have been in treatment for 21 days, they attend our recovery wellness program, which is an environment that holds our patients as they reintegrate back into society. And we encourage them to go and get involved in anything that's going to assist them in their recovery moving forward. And we're not really dogmatic in our approach. We do subscribe to complete abstinence, and we know that it's a holistic problem, and so treatment needs to be holistic and individualized. And we look at it from the moral dilemma, from the medical dilemma, but more importantly, we focus on the wellness component. So you are not your diagnosis, and there are multiple pathways to recovery, and the recovery comes from the individual. So if we can get people to buy into their own recovery, they'll most probably recover, as opposed to subscribing it to someone and trying to force someone to change. Okay, so I'm going to end it there. That's been our first live stream on YouTube from our YouTube channel, and let's see how that goes. Okay, thank you for watching, and yeah, enjoy your recovery. Goodbye.